It looks like you're ready to begin Module 3, the module on prenatal development. This happens to be my favorite module in the textbook, so hopefully you'll come to enjoy it, which we can define as a time period from conception until birth. Now, perhaps interestingly, the previous edition of the text included the birthing process. The current text which we're using has separated that out and has a sole chapter, standalone chapter on birth and the postpartum time. So definitely an expansion of some area, which I think you hopefully will find interesting. Let's now consider DNA. Do you know what DNA stands for? Hopefully you're thinking deoxyribonucleic acid. What is it? It's a self-copying, it's a self-replicating molecule which makes up our genetic information. What does it look like? Maybe you're thinking double helix. Well, that's our fancy term. Indeed, you're right. But what does a double helix look like? Well, a twisted ladder. Now, the discovery of its shape, its form, do you know the gentleman associated with that? Perhaps you're thinking, oh, I can't remember their name. I'll give you a hint. W-N-C. Watson and Crick. Did you know, though, that they came to this discovery by looking at a picture from a fellow scientist who had freely shared the picture? And yet she was given no credit. Who was this famous scientist that you've probably never heard of, who you should hear about? Rosalind Franklin, and her photo is known as Photo 51. And you're saying, 51, that rings a bell. Well, there was also an area of 51 where UFOs were supposedly stored, but this is a different 51. But anyway, so let's remember Rosalind Franklin's name and the famous or infamous photo number 51. Let's continue our exploration of basic terminology. I'm sure you're familiar with quite a few of these, but perhaps we're adding on a little bit of new information or just refreshing you. Either way is good. Let's start with chromosomes. These are the basic structures that hold our genetic information. Different species have different numbers. How many would be in a human body? In other words, a human somatic cells. This would contrast to the sex cells, the gametes. So think of the number that would be in a human body cell. Maybe a cell in your nose or a cell in your toes. It would be, you could either say 46 or 23 pair. How about for the sex cells, the gametes? And what are they? What's the male gamete? What's the female gamete? Well, you're probably tempted to say the egg for a female, the sperm for a male. How many chromosomes per a typical sex cell? That would be half the number of a body cell, so 23 total. Let's start looking at our basic technology. I had a student only yesterday in the first row lamenting all the vocabulary associated with psychology. He was right. We do have a lot of vocabulary. Those is really biology terms to begin with, but they're needed in our field as well. So let's go starting with DNA. Next, let's consider the gene, the basic unit of heredity, and we'll continue on the next slide. So let's see how you did. Megan's red hair and freckles, clearly observable and measurable, phenotype. Julio's genes for diabetes. Now you might say phenotype because you can measure and assess diabetes, but the question specifically is asking about Julio's genetics, his genes, so it's genotype. Same for Olivia, although we can definitely measure petiteness, the question focused on her genetics, so that would be genotype. And the next one, your particular eye color. Well, clearly we're looking at something that's observable, so that would be phenotype. And if you're interested in eye color, we now believe that it's controlled by now due to the Human Genome Project, we know it's due to 16 genes, and the majority of the input comes from one particular chromosome, that of chromosome number 15. Let's continue with our discussion about genes, our basic units of heredity. Each human body cell, or in other words, somatic cell, has roughly 20,000 active genes, and I'm rounding down a little bit. The gametes, the sperm, the eggs, but therefore contain considerably less. Next, consider the term genotype and phenotype. Genotype is a person's unique genetics, your genes. Your genotype is very similar to mine, but not exactly the same, and to your parents and your siblings. Again, the genotype, the sum of your genetic material. Now, the phenotype is what can we observe, our physical traits. Many have a strong genetic influence. Others are a combination of genes or environment. But in any case, phenotype are observable traits, what we can see. Before we go on to do a concept check regarding genotype and phenotype, I want to speak just a tiny bit more on genes. We know that there's roughly 20,000 documented genes in people. We know this because of the Human Genome Project. It began in 1990, which I know is before some of you were born, and ended in the year 2003, which I know is also before some of you were born. This is a hugely important endeavor, as important as our splitting of the atom or putting a man on the moon. And you may remember that in terms of our DNA, it's based on the twisted ladder, the steps, the basic building blocks of that DNA are the proteins of adenine, guanine, cytosine, and thymine. And now that we got that little background out of the way, let's do a concept check for genotype and phenotype. Consider the 4 examples and decide, is that an example of a genotype or a phenotype? Let's continue with our basic terminology. Now, you might remember from intro psych that the neuron is considered to be the most fundamental unit of the nervous system. Now, in the area we're talking about right now, the gene is the most basic unit of heredity. You probably know that genes come in forms of dominant and recessives. Dominants are expressed if the person inherits at least one dominant gene. Well, recessives are only expressed if no dominants are inherited to mask them. You should also know that most genetic conditions are due to harmful recessive genes. Now, many genes come in alternate forms. The term would be allele. So if you consider these 16 different genes that control eye color, some people inherit alleles for brown eyes, hazel eye, blue eyes, etc. So alleles are alternate forms of genes. Not every gene has an allele, but a huge number obviously do. Let's consider an applied question. If you have a neighbor, turn to your neighbor. If you have a housemate, maybe ask your housemate or a family member. If not, that's fine too. Let's say a boy inherits a harmful gene on his X chromosome, specifically the X on the 23rd pair, for color blindness. What happens? Will he be colorblind? Then consider the same question, but for a girl, or if you know the terminology, a cis girl. So on the 23rd pair, males have an XY, only one X in other words. So if he inherits a recessive gene, in this case a harmful one for color blindness on his X, there's no dominant healthy gene to override it, so he will be colorblind. But for the girl, she has two X chromosomes, and we're saying that she's inherited one for color blindness. We'll assume that if her parents aren't related closely, if they didn't meet at a convention for colorblind people, chances are extremely high that she inherited a normal, dominant, typical gene for colorblind, color ability to be seen. So she'll have normal color vision, but she's a carrier. So if she has a son, he is very likely, actually, he will be colorblind. But for the daughter, again, unlikely. But she could easily be a carrier if the girl inherits the X that has the deleterious, harmful gene. So let's see how you did. So to show the trait, that is of sickle cell anemia, one must inherit two recessive genes, one from mom and one from dad. So if they inherit one gene, will they or will they not have the characteristic, that is the sickle cell disease itself? The answer would be no. They have the gene for it, but it won't be expressed. So they will not have sickle cell, and for the next question, they are also protected against, and there's quite a few diseases caused by mosquitoes, obviously, but the correct answer would be malaria. And to give you an idea, it's very, very common in the U.S. With global climate change, and maybe more so in the Deep South. But the statistic that I was able to find, the most accurate one, was back in 2017, not that long ago. Roughly 220 million people were infected, and at that point, about 500,000 died. We do have a vaccine now, but it's only about 80 or 85% effective, is my understanding. If you look at the two pictures shown, one is showing a vein or capillary, and you can see that on the right, the oddly shaped red blood cells are doing a logjam. That's because of the sickling of the red blood cells, hence the name. And in the white and background picture, you can also see some of the sickle cells interspersed between the normal blood cells. Being a sickle shape, they are ineffective in carrying oxygen, so the tissue is poorly oxygenated, so it can cause organ damage, tissue damage in general, pain, discomfort, and can lead to an event that could be fatal. So a very serious condition. I wanted to add, just to be clear, the reason why the individual would not have sickle cell disease if they inherit one gene for sickle cell is because from the other parent, they would have inherited the very common, very normal dominant gene for typical circular red blood cells. So they would only have the disease itself when they had no dominant gene overriding the recessive flaw. Now, maybe you considered, why are recessive harmful genes maintained? If the person's less healthy, wouldn't they be less likely to survive, have surviving offspring? Wouldn't that gene just eventually be slowly eliminated from our our gene pool, from the human genome itself? Well, it appears that some harmful genes are maintained because under some circumstances they can actually offer an advantage. Let's consider the case of sickle cell anemia, which is produced by one recessive flawed gene. Now consider the blanks below and see if you can fill them in. The last one you probably don't know, so let me give you a hint. The last blank refers to a condition borne by a mosquito that kills millions of people every year. Not in this country, but worldwide. So take your best guess at the blanks and see how you did. Go ahead, if you will, please, and look at the box below. Try to determine what should go in the blanks, and after you've made a good effort, You can go ahead and listen and check your answers. Let's now consider Huntington's, sometimes given its full proper term, Huntington's chorea. It's a very unusual disorder in terms of genetics. Why so? It's controlled by a dominant gene. So if people with it are much less likely to survive long term, wouldn't it be phased out of the population slowly? You would think so. But before we consider that, it's a condition, obviously genetic. It is considered to be a neurocognitive disorder, so we'll learn about that in that particular chapter later in the course. Associated with uncontrollable movement, hence the chorea, like choreography means to dance, though it is not dance-like. But in any case, uncontrollable movement, extreme personality changes, extreme mood fluctuations, and an inevitable intellectual decline. So we pose the question, well, if it's so harmful, why doesn't it just disappear in the population when the people who have it die prematurely? Consider that. And also consider another question. Let's say that a person has just learned that their parent has been diagnosed with it. Assuming that they're not adopted, what is that individual's risk of developing it? Remember, it's caused by a dominant gene. So consider those two questions. So what's that person's risk? And why doesn't that gene just disappear? In terms of why doesn't it slowly phase out? Well, it only starts to kick in and cause damage and eventual death typically long after the person's had children. Not always, but typically. So that would be the answer. Now, nowadays, those children have to decide, do they want to be screened? Maybe they don't want to learn that they're carrying a death sentence. And maybe they decide not to have children. Maybe they screen, or maybe they just take a risk. But that would be the reason, since it appears after the person has had children. Now to your risk, a person who's had a parent with it, yes, it is a dominant gene, so if that person inherits that dominant gene, yes, they will have it, but you don't inherit all your genes from a given parent. You only inherit half. So if you inherit the half with the normal version allele, you're fine. You inherit the chromosome carrying that bad gene, you have the condition. So in other words, 50-50%. I just added 2 pictures to the slide. I hate plain slides. You'll see Dr. Huntington, who is not a person who had the disease, but the discoverer of it. Most conditions in which they refer to a person's name, it's not the sufferer, it's the doctor. So Alzheimer's named after Dr. Alzheimer's, Downs named after Dr. Downs, and so on. So Huntington's after Dr. Huntington. On the other picture, you can see a normal brain on the right versus one that's greatly shrunken on the left with huge ventricles, spaces where there used to be cells, and now there's just fluid. At the time of this narration, New Year's Eve, just about to become 2026, there are no treatments for Huntington's, though I just read a very promising middle phase study that's showing 75% improvement in individuals that it was used on, small study. Unfortunately, it has to have direct genetic intervention, gene therapy injected directly into the brain at 4 locations, a 10 to 12 hour procedure, but it's promising that something is on the horizon. Well, to answer that question, the picture on the right shows one such trait, the ability to roll your tongue. You either can do it or you can't. Another example would be freckles, dimples. If your earlobe style is narrow, which is often called attached, or it dangles, often called free. If your hairline is smooth or comes to a peak, like Count Chocula. So those are all controlled by one pair of genes, but most of our traits are indeed polygenetic. But you should know that very few human traits are controlled by a single pair of genes. Most are polygenetic, meaning controlled by many, many genes. Traits that are polygenetic include height, weight, IQ, personality, mental health. You are, though, probably familiar with some traits that are controlled by a single pair of genes. Think a moment. Do you know any of these particular traits? Let's now consider sex chromosome abnormalities. Would be an extra or missing sex chromosome. So which pair of chromosomes would that be? 16, 21, 23. Hopefully you want to go with 23, so the 23rd pair. Surprisingly, many people with a sex chromosome abnormality either don't know it until puberty or often never know it. The actress pictured is actually very famous. I don't know if you recognize her. Her name's Linda Hunt. She's Academy Award winning. She does have a sex chromosome abnormality. She has Turner syndrome. It's thought that the father of our country might have also have had a sex chromosome issue, as well as other multiple health problems. If you put in any particular one of these conditions, put famous people, many names will come up. Since most people have not announced that they have disorder, probably many or even most of them do not actually have the disorder that they're listed under. But let's look at the specific disorders. First level, take a look at the chromosomal pattern for the 23rd pair and decide if that person would be genetic / chromosomally male or female. When you see a 0, it means nothing. That person only had a one sex chromosome inherited. So do that as the first step, if you will, please. Let's start our discussion with sex chromosome abnormalities with individuals with an XO chromosomal pattern. And do you know which pair of chromosomes we're talking about? Is it the 21st, 23rd? It would be the 23rd. So this individual, she, will inherit an X from either her mother or her father, and somewhere along the way the other chromosome doesn't make it, so she only inherits one sex chromosome. She has Turner syndrome. She'll be on the short side, petite, and she's often will have learning disabilities. When puberty is expected, it just doesn't arrive and doesn't arrive and doesn't arrive, and at some point along the way she'll probably be taken to a physician and Turner syndrome will be discovered. She will probably have fertility issues. It's rather unlikely that she will be able to conceive or carry a pregnancy. She probably won't know it until puberty, and neither will her parents or anybody would meet her. In many cultures that don't have access to medicine, this would not be diagnosed. She would just be a person who is never hits puberty. Perhaps when you were looking at the images below, you noted that the Y is not shaped like a Y. And you perhaps wondering, why is it called a Y? Well, when the X was discovered, the discoverer chose that to symbolize unknown. He wasn't sure if it would stain the same as the other chromosomes, and before he tested that, he just used X for unknown. A different biologist, when looking at the Y, just chose the letter that came after the X. And this was all occurring in the early 1920s when the X chromosome was first discovered. If you're curious about the names, it was Hankins and Painter. You don't need to know those names. But that might solve a question that you might have had. Let's now consider an individual with 3 X chromosomes, basically the opposite problem of Turner's, too many. This person, since this person has no Y chromosome, she is a she. She's also going to have fertility issues and quite likely learning disabilities, but of a different nature than the Turner syndrome person. Hers will probably be in the verbal area, whereas the Turner's person more likely have spatial issues. I should mention that it's quite possible that the triple X person, the triple X woman, will not get diagnosed maybe until she tries to conceive and has issues, or perhaps never. Now let's move on to an individual that has a YO. So they inherit the Y, and would they inherit the Y from mom or dad? Well, since the woman has only the XX pattern for the 23rd, she can only contribute an X, so the Y would have had to come from dad. O indicates, like in the XO, that nothing else is inherited. This combination is not viable. When the X is lost, too much genetic information is lost, and it cannot form a complete human being without that information. So that is a non-existent pattern. Let's now consider the XYY male, sometimes called super male. The individuals will be much taller than average, will probably have a problem with acne. IQ is often in the low end of the normal range, and this would make high school and middle school probably very difficult. Tall, lanky, bad acne, low IQ. Uh, in the past, many were thought to be sociopathic because when they did genetic analysis, chromosomal analysis of people in prisons, the XYY male was overrepresented. They thought it was due to sociopathy, to a tendency to violence. But later studies looked at why they were in prison, and typically for nonviolent crimes. So the reason why they are more likely to end up in prison is with a low IQ. If they choose criminality as their career, they'll probably be less efficient at it and more likely to be caught. Rather interesting. We should mention that the XYY male, as well as the YXX male, are likely to go undiagnosed. But let's focus now on the YXX male. He has extra X's, but he has the Y, so he's clearly male. He has Klinefelter syndrome. You might wonder, with the extra X, is he feminized? And slightly, yes. He'd have a more rounded body profile, maybe more fatty tissue, rather comparable to a Native American male. He's likely to have fertility issues due to the extra X, and also likely to have learning disabilities of the same nature as the woman, the female with an extra X, so probably in the verbal area. So again, quite likely to go undiagnosed and therefore lead a very normal life. How common are the sex chromosome abnormalities? Not that uncommon. They vary dramatically in terms of each particular type. Klinefelter's, the XXY pattern being the most common, about 1 in 500 births. Others are 1 in 2 or 3,000. No, you don't need to know those numbers. Most people with sex chromosome abnormalities are not identified until puberty, though many never realize they have a sex chromosome abnormality at all. Let's start our discussion with sex chromosome abnormalities with individuals with an XO chromosomal pattern. And do you know which pair of chromosomes we're talking about? Is it the 21st, 23rd? It would be the 23rd. So this individual, she, will inherit an X from either her mother or her father, and somewhere along the way the other chromosome doesn't make it, so she only inherits one sex chromosome. She has Turner syndrome. She'll be on the short side, petite, and she's often will have learning disabilities. When puberty is expected, it just doesn't arrive and doesn't arrive and doesn't arrive. And at some point along the way, she'll probably be taken to a physician, and Turner syndrome will be discovered. Uh, she will probably have fertility issues. It's rather unlikely that she will be able to conceive or carry a pregnancy. She probably won't know it until puberty, and neither will her parents or anybody would meet her. In many cultures that don't have access to medicine, this would not be diagnosed. She would just be a person who is never hits puberty. Well, in terms of physical traits, the individual tends to be on the short side of average. Their limbs tend to be a little bit squatty, so the person wouldn't be a tall 6-foot model like body shape. They'll tend to have a little bit of extra body fat. If you look at this child's face, and I chose him because I think he's cute as a bug and a rug, the face is flat and kind of moon-shaped. The flatness is due to extra body fat. Now, if you look at this particular child, you'll see a distinctive eyelid shape, which is not necessarily present in all Down syndrome individuals, but it's common. You'll also see the nose tends to be small, and often the mouth is open and or the tongue is peeking out. It's not due to a large tongue, but apparently to a smaller inside mouth space. So common physical traits. Let's consider health problems. Did you come up with any? Quite a few big and bad ones. Heart defects are much more common in the Down's population. Sometimes they'll even have surgery prior to birth. In the old days, Down syndrome individuals usually did not make it anywhere near 50. Nowadays, typically they'll surpass 50. So heart defects common. Terrible immune systems. So in the days before antibiotics and vaccines, including flu and COVID, they typically did not get through childhood. Another problem, very common that they'll get Alzheimer's decades earlier than the general population. And these are just some of the health defects that are common. Now, psychologically, you can talk about the emotional nature of the typical person. They tend to be, as compared to other people in general, more cheerful, more affectionate, more happy. I actually saw a comedian last night that was talking about these individuals. He has a few in his family, apparently, and he said that they're great, they're happy all the time. He said the general population is a depressed, anxious mess, and they are not typically that way at all. Of course, there are exceptions, and I did work with an exception. In terms of intellect, well, somewhere in the intellectually disabled range. So if this individual does indeed have an extra 21st chromosome, how many typical, in their typical body cell in their nose, cell in their toes, whatever, how many chromosomes would we find? Consider that for a moment. A lot of students will say 49 or 48, but no, since instead of having a pair of chromosomes for the 21st, they have a tri, they have a 3, they have one extra chromosome. So if you know the typical body cell number for chromosomes is 46, the answer would be 47. I wanted to mention, in a different topic altogether, in Scandinavian countries, almost all Down syndrome fetuses are aborted. In the US, it's about 2/3. And you might wonder, looking at a child like this, why would anybody want to do that? I did have an acquaintance that did have a Down syndrome child. The child had severe health problems, could not eat orally, had to be fed through a port in their stomach, and every so often it would pop out, and they would have to hightail as quick as they could to the surgical center in eastern Massachusetts to have that port replaced. The individual, even though they were pushing 4, was still not not potty trained, and that probably was not going to occur. So imagine having a full-size child that you're still taking care of diapering needs and feeding needs and can never leave them alone for a moment. And then as you age, you have to face with your mortality, who's going to take care of the child in the excellent way you have? It's a big concern and it's a big worry. So I just wanted to share perhaps a perspective that you hopefully will never have to consider. So Down syndrome is typically associated with additional 21st chromosome, whether it's been relocated to the same spot or a different chromosome, we'll ignore. Its other name would be trisomy 21, again reflecting that 21st chromosome and having extra content. Risk factors for it would be not drug use, as some students think, but mom's age. Consider these 3 ages. A 30-year-old woman has a fairly low risk of having a Down syndrome baby, about 1 in 1,000 at age 30, doing a little rounding here. At 40, it jumps hugely to about 1 in 100. Early to mid-50s, it again dramatically jumps to about 1 in 10 or 1 in 12. So very strongly, in terms of risk, tied into mom's age. Dad's age appears not to be so much. Dad's age does appear to be tied into some cases of autistic spectrum disorder. So now let's consider physical traits, health problems, and psychological traits. Let's now consider Down syndrome. Take a look at the bulletin items and consider what you know about the topic, and then we'll proceed. Let's consider the relatively new field of science called epigenetics. Its focus is how the environment and experience can alter genes and genetic expression, and vice versa. For example, I very recently read a study in which they were looking at amount of aspartame, artificial sweetener consumption, and mice in terms of their anxiety levels. And mice that had higher aspartame in their diets were much more anxious. But interestingly, they looked at the offspring of fathers exposed to aspartame, and not huge amounts, well within the normal human limits. The offspring of the aspartame exposed male mice were also more anxious. And interestingly, it was not due to alterations of their genetics, but alterations of the cytoplasm within the cell, which apparently has modulatory effects on gene expression. Very interesting. You might say, well, how does that genetics influence the environment? Well, the environment picked by the animal, the environment interacted with by the animal or person. Go ahead and listen to the link. You just might see a question appear on it down the road. Let's consider twin types, starting with the basic 2 types and how they're formed. If I actually had a live class with this particular section, I'd be asking if anybody was a twin and definitely would have to get them to volunteer the type that they are. But if your class is not live, sadly we can't do this. So again, how are each twin type formed, starting with sperm and eggs as you think about the answer? So fraternal twins form when mom releases 2 or more eggs, and each egg is fertilized by its own sperm. Now this might be obvious to you, but I guarantee if I was asking this in class, I would not necessarily get that answer. How much genes do they share in common? Well, as a hint, the same as any other set of siblings would, which would be 50%. So can they be of different sexes at birth? Absolutely. Factors affecting mom's age. Older women tend to have more fraternal twins. Racial differences. People of color, specifically of African descent, does not include other people of color, so I really should say African descent, have a much more high rate. The highest rate in the world is the Yoruba. You see a Yoruba couple on the bottom left. They have 1 in 22 births. That's compared to the overall rate of fraternal twins of being like 1 to 2%, so 4 or 5 times as high. Individual genotype, in other words, it definitely is in some people's genes. It does run in families. Now let's compare that to the identical twin. So how are identical twins formed? Mom releases 1 egg, fertilized by 1 sperm, and at some point it separates, hopefully into 2 clean units. If it's not, what do they call that? The old term was Siamese twins. The modern term is conjoined twins, but hopefully they'll separate cleanly into 2 different individuals. What percentage of genes do they share in common? Well, since they're identical, it's 100%. Do they have to be the same sex? Yes, you can't take the same recipe and get a male in one version and a female in the other. So identical genetically, always the same sex. In humans, conception is the process in which 1 sperm cell and 1 egg cell unite. That's assuming that there won't be a multiple pregnancy occurring. Most sperm cells are viable for 1 to 5 days, and eggs for typically 1 day. Intercourse is most likely to cause pregnancy 5 days before ovulation through the day of ovulation. But don't play the odds. Over 3 million Americans do yearly and lose with an unplanned, unintended pregnancy. About half of those would end in an abortion process. And also don't forget that although fertility and pregnancy can only occur a few days each month, HIV and STI infection can occur any day of the month. So a few facts you're probably already aware of, and just to refresh your mind. Let's consider conception, the process in which the egg is fertilized by the sperm. I find this picture interesting. I hope you do too. The gametes, egg and the sperm, contain the same amount of genetic information, and look at the size difference. The egg, or if you prefer ovum, is about 10 million times bigger than the sperm cell. Also perhaps interesting is 1 egg is more than enough to cause fertility, result in fertility, and yet the ejaculate has between, maybe on the low end of it, 20 million sperm cells, on the high end as much as 10 times that or so sperm cells. If at least 50%, probably 60% of them are not healthy, there'd be infertility or at least fertility issues. And the bottom picture shows you some of the common types of malformed sperms, including head issues on the sperm or tail issues and so on. Let's see how you did. We'll start with the whale and go clockwise. The whale is very variable. I know you're debating between the 10 and 18 months and 18 and 22. It would be the 10 to 18 months. And if you're interested, what is the 18-monther? That would be the orca, the killer whale. If you notice in the picture, the placenta is still connecting the newborn baby whale to its mother. Next would be the llama. That'd be 11.5 months, though sometimes will actually go over a year. That's a newborn baby just learning how to stand up, probably hasn't even nursed yet. Next we have a kitten, very similar to dogs. On average for the kitten, 63 days. Next we'll consider since we're going clockwise, next consider the elephant. That would be the longest of all mammalian species. That would be the 18 to 22 months. There's a little bit of variation between the African elephant and the Indian elephant. Next, we'll see the newborn puppy. That would be on average 64 days. And going to the mouse and rat, the mouse would be on average 20 days, and the rat on average 22 days. I only put a picture of one in there. I hope you're okay with that. So hope you found that interesting. In the previous slide, we defined prenatal development as lasting from conception through delivery. In other words, the time period of gestation. I thought it might be interesting for us to look at the gestation period of a few species, that of mice, rats, dogs, cats, llamas. I might say, why llamas? Well, I own llamas, okay. Llamas, elephants, and whales. Hope you find it interesting. When you're done guessing, click the listening icon to see if you're on target or quite a bit off target. Let's now consider the 3 stages of gestation. Sometimes I ask this on the test and I get trimesters instead. No, gestation would be for the following terminology and concepts. Germinal stage. I don't particularly like that term, but the biology people are fond of it. You might know it as the stage of the fetus. First 2 weeks from fertilization to implantation of that fertilized egg. The placenta is going to start to form. Next stage, embryonic. Conveniently, if you're trying to learn this, stage 2 is end of week 2 to end of month 2. So a whole lot of 2s. So now you're laying the groundwork for the rudimentary structures and organs. Can feel pain at 24 weeks. That's 6 months. I think that's important. Fetal stage. Well, stage 3 begins in month 3. Again, very nice if you're trying to relearn or learn the concepts. The growth and finishing phase, we'll call it that. I should mention the picture that looks like a raspberry. That's actually a fused egg and sperm cell. It's a fertilized egg. It has now been dividing, so the first cell divides in half, then each of those divide in half until you get a round spear that forms. That's called a morula if you want to be technical. There's also a blastocyte. You don't need either one of those terms for this course anyway. Eventually it'll invert in itself, and that inversion will become the neural tube, which will become the brain and the spinal cord. Next, let's consider the topic of teratogens. The study of it is teratology. That's the topic that I did my master's on in graduate school. Teratogens can cause harm when the developing zygote or embryo or fetus is exposed to them. Some are easily avoidable, others not at all. So let's look at some examples. Alcohol and other drugs. Often students will want to say caffeine or nicotine. Well, remember, caffeine and nicotine are other drugs. Now, these other drugs can be street drugs, commonly used drugs such as tobacco, which is not a street drug, and some can actually include prescription drugs. Bacteria in foods. Can you think of any foods that pregnant women should avoid based on bacteria that could be in them? Well, apparently unpasteurized honey, heavily processed foods like salami. Women should definitely not do rare hamburger, for example, or if you thought sushi, you are correct. X-rays. Women are typically asked in, say, a dental office, could they possibly be pregnant? X-rays are a teratogen. Consider some diseases that can be passed from mother to child either prenatally or in the birthing process. What can you come up with? Go ahead, think of it. You might say HIV, and you are correct. I would like to mention that in this part of this country, it's really almost of no excuse that a baby is born HIV positive if the mother was pregnant in this country. HIV testing is free, and if the mother does have HIV, she can be provided free of cost drugs that will virtually eliminate the possibility that her child will be born HIV positive. So HIV is certainly a good answer. What about the disease that is shown in this picture? That would be the Zika virus. Measles. Women who have not had their measles shot, if they become pregnant, risk having their child exposed to measles prenatally, and that can be devastating. Blindness, deafness, intellectual disability can result. So many diseases are teratogens. What about metals, and how would the woman get exposed to the metals? You might be saying mercury. Well, how would a woman get exposed to mercury? There's no mercury in thermometers anymore. For example, certain fish that are heavy in fats, fish from the Great Lakes, for example, I would not go near. Fish like swordfish are also ocean fish that are at risk of having too much mercury. This, of course, was just a partial list. So now let's consider FAS, FAE, and FASD. What do each stand for? You might be saying, I know the first one. You probably do. FAS, fetal alcohol syndrome. FAE, you're probably not familiar with, but that's okay. Fetal alcohol effects. And both of them are now being subsumed into the current term, FASD, fetal alcohol spectrum disorder, reflecting as we see this on a spectrum from light, which would be the FAE, to the severe, which would be the full-blown FAS. Let's start with FAS, key features. One would be the child will always, and as adult will always have a certain degree of intellectual disability. Another feature, there will always be bodies of the area that are affected, which vary from individual to individual. One might have a heart defect, another might have a bone structure issue, another might have a hearing issue, and so on. So they always have other parts of the body that are affected other than the brain. The third defining feature is the face. They're not terrible changes, but consistent changes. If you look at these 4 children's faces, you'll see certain things are just a little bit off. The increased space between the eyes, the space between the upper lip and the nose being large, in part because the nose is a little bit smaller, the upper lip is smaller, and that vertical groove that most of us have to break it up is missing in the FAS child. Now let's consider the lighter end of the spectrum, FAE, fetal alcohol effects. Common features would be hyperactivity and or learning disabilities. And aren't we seeing a lot of kids with those issues today? Well, some, not all by any shot, but some are due to alcohol exposure. Prevention, easy theoretically, difficult in practice. Mom's got to avoid drinking even when she could conceive, and maybe she's not actively planning. There have been documented studies of 1 week of heavy alcohol exposure can produce full-blown FAS. Even one extreme bout of heavy drinking, ill-timed, can produce FAS, though it is typically chronic longer drinking. A related question, is it safe for a pregnant woman to drink 1 beverage a day? No. She cannot get an FAS baby out of this, but studies have compared just that, women who drink 1 beverage a day, and the children's learning is detectably, measurably, in a laboratory, slower, which means the brain has been affected. So drinking for a pregnant woman, pregnant person, no, should not be done. There is an existing body of knowledge of the effects of marijuana as teratogens, but this research often is of much poorer quality, and certainly we can't give marijuana in a study with an experimental control group and see what happens to the children in the experimental group. That would be obviously highly unethical. So these studies are correlational in nature. But with the recent number of states that are legalizing marijuana for recreational use, we'll see much more numerous studies and probably much higher quality of studies. But one documented outcome is a significantly higher rate of learning disabilities in these children. Newer research is also showing a correlational relationship with prenatal marijuana exposure and autism spectrum disorder. We know that children that have been exposed to tobacco have a significantly higher rate of SIDS. This does not mean that every SIDS baby was exposed to tobacco, and certainly not every tobacco-exposed baby will experience SIDS. Do you know what the letter SID stand for? If you're thinking sudden infant death syndrome, you are correct. Lung issues, definitely. 20% of American children have asthma. Tobacco exposure is a major cause. Ear infections are much more common in children that are regularly exposed to tobacco smoke. Cancers. Certain cancers are much more prevalent in the children of smokers. What a terrible thing to do to one's child. Lower birth weight. On average, tobacco-exposed children weigh a half pound less. Now, a half pound to your eye is nothing, but if you only weigh 5 or 6 or 7 or 8 pounds, a half a pound is a very big deal. Babies with lower birth weight have a significantly lower rate of survival. Also, potentially lowered IQ. Some correlational studies suggest that on average, the children of smokers have 7 IQ points lower. And 7 IQ points is a big deal. If I give you 7 extra IQ points, take it and run, it would make your college life easier. If I try to steal 7 of your IQ points, don't let me, that would make your college life considerably harder. These are just some of the effects of tobacco on children. Let's now consider the effects of tobacco on the child. I'm not going to distinguish prenatal from postnatal development. And I say tobacco, not nicotine, because until now, people rarely expose themselves to just nicotine. With vaping, that's new, and we'll probably see much more research that is nicotine specific. But in the past, the woman would have been exposed to smoking, for example, which would not include just nicotine, but literally thousands of other highly dangerous chemicals. I hope you find this picture disturbing. I did. Can you take a moment and think of as many effects that you're aware of tobacco on children? When you've done this, you can switch to the next slide and see how many of them that you were actually able to propose. If you notice, the PowerPoint had an E on it and the picture of the drug did not, and we're wondering, let me explain it. Every drug has 3 names. It has the brand name, the generic name, and the highly chemical name. So, for example, if you like Excedrin, it's the same thing as acetaminophen, but Excedrin would be the brand name. Some people believe that if something's organic and natural, it must be safe, which is rubbish. Many things in nature are highly toxic. Consider mushrooms and many other plants. Another confusion is that if it's a prescription drug, it must be safe. No, not at all the case. Consider thalidomide. Are you familiar with what effects thalidomide can have if taken by a pregnant woman in terms of her developing embryo or fetus? Let me tell you a little bit of the history of this drug. This drug was first created in Germany. The company called it a wonder drug and claimed it cured everything from acne to impotence. One thing it did, though, was help to deal with nausea, and who's nauseous but pregnant women? So the FDA was doing a very limited trial of about 20,000 individuals. And the sad thing about this in particular was it was never adequately tested on animals. If it had been given the typical animal testing before moving to the human trials, this entire tragedy could have been prevented. No one likes animal testing. I certainly don't. But given the choice of giving it a drug to pregnant women or pregnant rats, I'll take pregnant rats 10 times out of 10, and I suspect you might too. We noted that prescription drugs can also be teratogens. Have you ever heard of the drug thalidomide? And are you aware of what specific effect it had on the children exposed to it? Take a moment and think about that. All these children were exposed to thalidomide prenatally, and as soon as the babies began to be born, the shocking and clearly and quickly linked to thalidomide. These children are sometimes called flipper babies because the arm is often a flipper-like appendage. Back in high school, my best friend's cousin was a thalidomide baby. Her arms were about roughly normal length, a little bit shorter, same with her legs, but they were fused with limited mobility at slightly odd angles, and her toes and fingers were also fused as well. At that point, even though she was a young woman, she had over 20 surgeries trying to give her greater mobility and use of her arms and legs. Let's consider another drug that can cause teratogenic effects, the anti-acne drug isotretinoin, if I'm saying that correctly. Even short-term exposure, babies will be born with either small ears, sometimes no ears, and or eye defects, or believe it or not, even more severe defects than that. It can also occur if the mother is using the product while she's nursing. Imagine how easy it would be to maybe give the anti-acne drug to a friend because it's not working for you without giving them that warning, or perhaps a woman's using and her birth control method fails. Common reasons why maybe a hormonal birth control method might fail would be use of antibiotics with it. Many people don't know that, or use of the antidepressant over-the-counter St. John's wort. So even, again, short exposure to this drug during pregnancy or nursing can have profound effects. You may or may not be familiar with Rh incompatibility, but I'd be willing to bet that you've watched medical shows in which they call for blood for transfusion being B positive or B negative. Well, this is rather what they're talking about. So some people have a particular protein, the Rh protein, they're positive, like in a B positive. Other people lack this blood protein, they have the negative, like in B negative. Rh stands for rhesus because it was first detected in the rhesus monkey blood cells and later also found in humans. Now, when it comes to human pregnancy, or rhesus pregnancy for that matter, the problem happens when mom lacks the antibody, the protein rather. She lacks the protein, shown for the negative on the picture, and the baby inherited the positive from the father. So the first pregnancy, this is fine, will cause no issues. But there's a certain degree of blood mixing during the birthing process. Some mom will start to create antibodies for the Rh positive blood type. So if she carries another baby that's Rh positive, her immune system will set out to destroy the baby's blood. And obviously, this can be lethal or highly damaging. In the late 60s, a simple immunization became available that prevents this process from happening. It's still problematic in some area of the world where they don't have access to this modern medicine, and the effects can be devastating. But a brief history of the Rh incompatibility issue. In the past, before we could prevent this issue, a woman would have a healthy baby, and depending on the genetics, maybe a healthy baby or not. Usually the next one would be sickly and or die, and from that point forward or onward, every baby would die. One of my partner's friends had this happen in his own family, at least as his family is when he was a child, that is. Let's consider maternal blood testing. Almost universally done in this country. Why not? It's just a blood test, non-invasive. I will admit I'm a wuss on blood tests. But anyway, it screens for a variety of conditions, including Down syndrome, neural tube defects. The neural tube forms the brain and the spinal cord. So the picture shows 3 possible neural tube conditions. No, you aren't responsible for those 3 names and what goes with them. But anyway, it can also screen for genetic conditions that may be of concern given family history, maybe of a family history of sickle cell or PKU or Tay-Sachs or any number of conditions that they might be able to screen given what's the cells that leak into mom's blood supply. I should caution against false positives and false negatives. Consider those terms and see if you know or maybe can guess what they are. Next, let's consider prenatal diagnostic methods. Some are done in almost every pregnancy in the US, versus others are very uncommon and done only with specific reasons in mind. Well, a false positive is an indication that there may be a problem when there's really not. Obviously, it would very much scare the parents. A false negative is when there is a condition of concern and the test says they're not. I've had so many students over the past who have had false positives leading to more invasive procedures such as amniocentesis or CVS, and in every single case it was initially the case of a false positive, but still of concern, obviously, even though relief once it is a false positive. Let's consider maternal blood testing. Non-invasive, just a blood test, typically done in first and second trimesters. Screens for many, many things, including neural tube defects, that means of the brain and spinal cord, also Down syndrome, genetic conditions that might be a concern for because of a particular family's history. The cells actually will be in the blood supply to a small level if the fetus does have it. Sickle cell, Tay-Sachs, PKU, and many other conditions. There is a concern about particularly false positives, and I've had this happen to students who shared the experience where it's indicated that there's a problem, and then that requires more invasive testing like a amniocentesis or chorionic villus sampling, and then happily, thankfully, the results are negative. The fetus is not carrying those particular genes, but the false positive rate can be very problematic and very scary. So let's consider amniocentesis. You probably are familiar with the term amniotic sac. Well, in this procedure, a rather long needle is inserted, and they use a topical anesthetic, but that's all they can do. So a rather long needle is inserted through the abdomen, then through the uterine wall, through the amniotic sac, and they're doing an ultrasound while doing this so they don't accidentally nick the baby. A small amount of fluid, a moderate amount of fluid is drawn out and analyzed. The fluid has the cells of the baby, so it's a way of getting the cells of the baby without actually interacting or damaging the fetus. This is not typically done unless there's a pressing reason. Maybe there's a suspicion of Down syndrome, there's other conditions that need to be screened for that are unusual. It can't be done until month 4, so if the couple or the mother would abort, or the pregnant woman, the pregnant person, we really should say, if the pregnant person would abort, it's got to be done early enough, so this would be an option. An alternative to amniocentesis is chorionic villus sampling. You might not be familiar with this one, in part because most people have heard about an amniotic sac or amniotic fluid, versus most people probably have not heard about the chorion. The idea behind it's the same. There's going to be a needle used that's going to pull out tissue, again, not directly of the baby, but in this example of the chorion, which is a tissue related to the placenta that has the same genetics as the baby. So we're getting baby without damaging baby. The advantage of the chorionic villus sampling is it can be done much earlier than an amniocentesis, as early as 2.5 months, and you might remember that the amniocentesis can't be done until 4. The disadvantage of both the chorionic villus sampling, or CVS, and amniocentesis is that there's a small risk of miscarriage, about 1%. So your odds are very good, but if a doctor does 100 of these procedures, a baby will be lost. So it's still worth considering. Again, only done when there's a particularly strong need to assess the genetics of the fetus. Believe it or not, a woman that's 35 years or older who's pregnant is considered to have a geriatric pregnancy. It is associated with increased risks, including gestational diabetes, which means the baby can be born much larger than normal if it's not properly controlled. Also, preeclampsia, which could lead to toxemia. Either one of those could be a threat to health or survival of mother or baby, as well as other conditions. So it's usually very closely monitored, not necessarily contraindicated, but very closely monitored and is considered to be increased risk as compared to a more typical age pregnancy. Let's check your chart reading ability. Examine the chart below, which looks at maternal age and the rate of complications. You can see the different colors are used to represent different ages of moms, and draw a conclusion or two, the most maybe obvious conclusion or two. And click the next icon to see if your conclusions match mine. So we see if we look at the green bar, there's starting to be a significant change between mom's age and negative outcomes in 3 different areas: maternal, preeclampsia, low birth weight, and actual fetal death. So at the green level, which is 40 to 49, you're seeing an increase. But we see a huge increase at age 50 to 55 in these 3 measures. So we can say that there is a positive correlation between complications and age of mom. As mom's age goes up, so does the complication rate. If mom's age goes down, the complication rate goes down. Let's look at a few of the common miscarriage causes. And there's quite a long list, and this is only a partial list. First, we see gestational diabetes. Many women, for the first time in their lives, experience diabetes while pregnant. Typically, after the pregnancy ends, her blood sugar levels go back to normal. This does let her know that she's at risk of future diabetes, so it's particularly important for her to keep her weight in check. Gestational diabetes can affect the baby, can result in miscarriage, or babies that are born very high birth weight, making it difficult for the mom and for them to be delivered. There's also preeclampsia, or outright eclampsia, or toxemia. This occurs when there's too much something in the urine, causing severe swelling, technically edema. And that suggests there are problems in one particular structure. Think for a moment and see if you know what might go in the blanks. Too much. Now you might be tempted to say sugar based on the previous question, but no, it'd be too much protein in the urine, which would cause severe swelling, in other words, edema, denoting kidney problems. This can be a toxic condition, so either it can cause us a little bit of swelling in the foot and leg, or it can be life-threatening to both the baby and the mom. Sometimes, if it's severe enough, if it's full-blown toxemia, there might need to be an emergency C-section. Hormonal issues can be a cause, specifically low progesterone, the literal pro-pregnancy hormone. Sometimes they can be successfully addressed in that pregnancy or for a future pregnancy. Genetic and chromosomal issues are particularly likely to be cause for when the fetus is lost as a embryo, or even before pregnancy is known, as a zygote. Infections can also be caused and will be considered on the next few slides. Do you recognize the condition that this poor young lad has? It came to world attention in 2016. His mother was exposed to the Zika virus, causing profound changes in the skull and brain, leading to massive intellectual issues, profound intellectual disability. Not much of a problem in the U.S. for Americans unless they were traveling. So limited issue in this country, but a serious problem in Central and South America. Infections can also be a cause of miscarriage. Consider oral infections, gum issues. We now know that having bad gums, periodontal disease, is a risk factor from everything from heart disease through miscarriage. So oral hygiene and health is very important. Also STIs, both bacterial or viral. Hormonal issues, particularly the pregnancy-related hormones, prolactin, and more so though, progesterone and estrogen. So if estrogen levels are too low and progesterone levels are too low, miscarriage is likely. Nowadays there's many hormonal medications which would help with this issue very, very significantly. Also, certain genetic conditions or chromosomal issues can cause the early loss of a fetus. And it's probably a little comfort to the parent, but many of these babies that are lost in early miscarriage have profound issues and would have never survived if gone full term, and would have a dramatically devastating health history. Again, probably a little comfort to the grieving parents. As you know, some tratogens are of a viral or bacterial nature. This slide will consider some, but we'll still focus on a couple other ones separately since they're important enough to get additional discussion. Viral tratogens include rubella. Hopefully, no matter what your sex or gender or your intention to have children or not, hopefully you're up on your MMR. But for a person that could become pregnant, this is particularly important. Having rubella during pregnancy can result in a child that's hearing impaired or visual impaired or fully without vision or hearing, heart defects, brain damage, a ton of issues, and so easily prevented by immunization. Not much trouble in this country, but if you travel or you get exposed to somebody from another country who's not immunized and you're not immunized, it could be a big bad problem. So easy to prevent. Also hepatitis of the B variety. If mom does have hepatitis, when the baby is delivered afterwards, they'll start a regime of shots to prevent them becoming hepatitis B positive. CMV we're going to consider on a separate slide. Other viral tratogens are STIs, such as herpes. If mom has an active herpes infection, that can cause brain damage, vision loss, and other terrible things. So if mom is active in infection with herpes, a C-section will be typically done. HIV, in this country, not much of an issue, because if mom is HIV positive, she will take medications, and those medications will fully prevent that child from being born with HIV. Obviously, in countries that don't have this medical advantage, this is a huge issue. Bacterial infections include STIs. Now, mom can be treated during the pregnancy, so that's very good news, and she'll be screened as part of the pregnancy process. I would mention that the specific antibiotic tetracycline can cause teeth staining, and not all doctors are up on this, and from personal experience, but of course I'm much older than probably most of you, tetracycline, if given to a pregnant mom, can cause staining of that child's teeth later on. They don't even have teeth formed yet, but it can cause long-term teeth staining. So make that a consideration if you are a pregnant person and you do need an antibiotic. Ask about that particular risk, because why do that to the child, at least knowingly. Let's consider a parasitic tratogen, that of toxoplasmosis. If you're at all familiar with it, you probably associate it with cats, and that's a good association. Cats that are outside that hunt will pick up the parasite, which can be transferred to a person. And having toxoplasmosis in adults is usually undamaging and unnoticed, but they can pass it to a newborn. In terms of pregnant people, if that pregnant person does have toxoplasmosis, half the babies will be preterm, and preterm is such a huge health risk. In terms of how the pregnant person or how anybody can get toxoplasmosis, okay, so cats are a risk, particularly kittens. They have a much higher load. So if you go to a friend's house and they have an adorable kitten, restrain the urge to pick it up or pet it. And if you do, wash your hands really, really well, like over 30 seconds, It can be from undercooked meat. One way that you can take the meat out of the equation is if you freeze the meat for a couple days, it does get rid of this particular parasite. Not all parasites, but this particular parasite. So that's an easy way to protect. It can also be from unwashed or improperly washed fruits and vegetables, and gardening. So wear gloves if you garden, and wash your hands after gardening. So there's a few simple things you can do that greatly decrease that baby's risk. Most babies that are exposed are fine, but some do have abnormally small or big heads with intellectual disabilities, cerebral palsy. So the problems can be very small. There's a huge list of small problems or huge problems like the ones I just mentioned. And this one particularly shocked me. An individual who was born with it, no symptoms, not detected, can still get problems 20 or 30 years later, including pneumonias, seizures, eye or vision problems. That kind of blew me away. So do ask your doctor if you're a pregnant person or a partner or a pregnant person about toxoplasmosis testing. I thought that CMV virus deserved its own slide. CMV stands for cytomegalovirus, which you do not need to know what it stands for. It's relatively common. More than half of adults have it with no symptoms, so it's very common. It can be spread by close contact, including food sharing. In some daycare centers, it's 100% of the children have been exposed because it transmits easily by caretakers or from child-to-child contact. In some countries, virtually 100% of children will get exposed to it. The babies that are exposed prenatally, half of them will be preterm or low birth weight. We know how serious that is, or we will in this chapter. If the child develops it after birth, symptoms will include a rash, hearing or vision symptoms, or yellowing of the skin due to liver issues. And there's many more symptoms, but those are some of the big ones. So rash, hearing or sight, or yellowing. It's considered to be a major cause of, in children, it's a major cause of the congenital, that means born with, it's a major cause of congenital vision issues, hearing issues, and in general, severe nervous system issues. So although it's usually not an issue at all, it has the potential to be quite serious. I thought that CMV virus deserved its own slide. CMV stands for cytomegalovirus, which you do not need to know what it stands for. It's relatively common. More than half of adults have it with no symptoms, so it's very common. It can be spread by close contact, including food sharing. In some daycare centers, it's 100% of the children have been exposed because it transmits easily by caretakers or from child-to-child contact. In some countries, virtually 100% of children will get exposed to it. The babies that are exposed prenatally, half of them will be preterm or low birth weight. We know how serious that is, or we will in this chapter. If the child develops it after birth, symptoms will include a rash, hearing or vision symptoms, or yellowing of the skin due to liver issues. And there's many more symptoms, but those are some of the big ones. So rash, hearing or sight, or yellowing. It's considered to be a major cause of, in children, it's a major cause of the congenital, that means born with, it's a major cause of congenital vision issues, hearing issues, and in general severe nervous system issues. So although it's usually not an issue at all, it has the potential to be quite serious. Let's consider the age of viability. This is the age that the baby can survive outside the womb. Do you know which particular organ is most involved in this survival or lack thereof? Maybe you're thinking brain or heart, but actually it would be the lungs. There's a dramatic difference in viability between week 23 and 24. At week 23, infants that survive, which would only be about 50%, most will have severe neurological issues such as severe cerebral palsy. At week 24, 70% survive and very few with cerebral palsy or other conditions. So dramatic difference based on age. Many, if not most, hospitals will not attempt to save a fetus before week 23 because of the devastating outcome if the premature baby did live. Cerebral palsy is a family of neurological disorders caused by brain damage, most typically associated with the birthing process. The key feature is the issues with movement. The individual might have just some issues, maybe needing a leg brace. They may need a full wheelchair and obviously other assistance. The other issues that are comorbid with it, in other words, co-occurring, are very variable. The individual may have intellectual disability, or I did have a student with cerebral palsy who did obviously fine. They can have trouble swallowing, which can make it very difficult. They might need a port for their stomach if it's severe enough. It can also involve sensory systems such as visual impairment to full blindness, hearing impairment to full deafness, and epilepsy is not particularly uncommon in this group of individuals. Let's see how you do on this review activity. So first one, male, so we know he's got to have a Y. And fertility issues, feminization and learning disabilities, that would mean an extra X. So that would be, in addition to the typical XY, he would be an XXY or a YXX, either way. For the female, so we know that she's got an X with no O's. Puberty but fertility problems, she has an extra X, so XXX. Next one, this individual is tall, acne, slightly lower IQ. In the past, were thought to be sociopathic incorrectly, so it would have to have an X and a Y, because this would be a male we're talking about, if you remember. And it'd be an extra Y, so XYY, or you could flip it the other way around if you wanted. Non-existent, that would be the YO. This person is short, no puberty, fertility problems. This would be the XO female. Now, in terms of names, the super male would be the XYY. The Turner syndrome person would be a female of XO. Klinefelters would be the male with the XXY, and triple X would be the female XXX. So there you go. This activity is similar to the other one, but goes at the same content at a different angle. So first one, male, so we know there's got to be a Y there. Fertility issues, feminization, that would be the extra X. So that would be Klinefelter syndrome. Female, so we don't want a Y there, so female has puberty, but fertility issues and learning disabilities. So since she does have puberty, she would definitely not be the XO. She would be the triple X, or sometimes called trisomy X. Next individual, tall, acne, low IQ, in the past were thought to be sociopathic, which they were not. This person would be a male. That's a help. So that would be the quote-unquote super male. Next one, where the individual has just a Y chromosome with no corresponding X, not possible, not viable, too much genetic information to be lost to make a person, so the not possible choice. And the last one, short, female, no puberty, that's the key from the other one, no puberty, fertility issues, and learning disabilities, of, in this case, a spatial. That would be a female with just one X. So that would be the XO, so that would be Turner syndrome. So go ahead and try this activity and then check your answers. So first blank, 3 stages of what? Gestation, delivery, fetal development. We'll go with fetal development. Stage 1, stage of the, you can go with blastocyte or you can go with zygote. And is it the entire first month or the first 2 weeks? It's the first 2 weeks. Stage 2, stage of the embryo. And how convenient for people trying to learn this. Stage 2, well, it begins at the end of week 2 to the end of month 2. So that we have our 2s. Stage 3, very conveniently, if you're learning it, is from the 3rd month to the birth. And its term, well, stage of the fetus. You might have noticed that sometimes I use the term pregnant woman and sometimes I use the term pregnant person. I would explain it as old habits die hard, and pregnant person is the term preferred nowadays and is reflecting where we are culturally. The pregnant person would reflect not only that women can get pregnant, but also trans men who were, yes, born women, but have transitioned to male. So in terms of the details of this, if you go to the link, I think the gentleman there does a wonderful job explaining it. So now let's consider some of the many birth choices today for the pregnant person. Home birth versus hospital or birthing center. Preparation choices such as Lamaze, hypnobirthing, or the Bradley method. Pain control or not. You might be surprised to learn that culture plays a huge role in how pain is perceived and how it is dealt with. Fear dramatically increases pain, and the modern preparation techniques try to address this to reduce or eliminate pain. Reduce is probably a better goal. Well, probably most of us, when we think of home deliveries, think of pizza or more likely Amazon nowadays. This would be handled for delivery of the baby, for a certified nurse midwife. It is not for high-risk deliveries, and the midwife under that circumstance would absolutely flat out refuse to participate at the home. She or he might be, typically she might be very happy to do it at the birthing center or at the hospital, assuming that they have privileges. So take a moment and guess, if you'll humor your teacher, what percent of American births are home delivery? 18%, 14, 8, 12, 6? Take a guess. Oh, come on, take a guess. It might surprise you, less than 1. And a substantial portion of these were unplanned. For a short time, women were opting to be chloroformed right out of consciousness. Queen Victoria really made this a popular but short fad. Watch the 2-minute history on birth. I think you'll find it very interesting. Now, in terms of modern pain control, epidurals are quite commonly used in the delivery process. Take a guess. 25%, 75, 100? About 60 to 70% of women will select an epidural. The area of skin is numbed, then the needle is inserted. Typically, pressure is felt, but not pain. I'm told the most uncomfortable part of the procedure is often having to curl up kind of ball-like to give sometimes the best angle for the deliverer of the drug. A small catheter is left inside, so pain medication can be delivered. Nerve damage is rare, less than 1%. Spinal headaches could happen, but also rare, less than 1%. So you can see why many women would select this particular option. Though a newer option, again not typically available at hospitals, but often at birthing centers, would be the use of acupuncture. Another birthing option would be the birthing center. Take a moment and guess, and you probably don't know, but just take a wild guess at what percent of American births occur at birthing centers. Humor your teacher, go ahead and do it. Are you thinking 20%, 15, 10, 5? It might be surprising, but only about 0.5%. Now, what are they? They're usually freestanding and not usually part of a hospital, but again, maybe, such as St. Peter's. But they offer a nice alternative to home birth. It's homey. You can look at the picture. It might look like somebody's bedroom except for the bathtub. Again, many do offer bathtubs. But it also offers much more medical support and medical services. Now, certainly they can't do a C-section. The person would have to be shuffled out very quickly to a hospital, but a greater degree of medical intervention is possible. The births are typically handled by a certified nurse midwife or a very related professional. Not for high-risk deliveries. So certainly a nice option to discuss if you're thinking about bringing a new baby into your family. I should also add that birthing centers are not just for where you go when you're giving birth. They give support throughout the pregnancy. And another possible advantage of birthing centers is that they're less restrictive than hospitals, both in terms of what's done, such as fetal monitoring and decisions of who's going to be present, for example. Let's start with labour, also known as gentle birthing, because it's distinctly different. Its focus is not the birthing process, but on minimizing trauma to the baby after birth. So the baby will arrive to a dim room, which medical people might not be able to thrill with. They want to see well. Laying on the mother's belly until the umbilical cord stops pulsing, a warm bath, etc. So very distinct from the remaining ones. Lamaze is the most commonly used method, and it's a method upon which all the other ones are based, so it gets its full slide. But let's consider, before we move on to the full slide, hypnobirthing was first developed by Grantley Dick Reed. Some years later, modified and reintroduced by hypnotherapist Maria Mangan, so sometimes called the Mangan method. Uses self-hypnosis and other techniques to minimize fear. We also have the Bradley method, sometimes the husband coach method, but partner coach should be used. Empowers couples so that they can go through an unmedicated birth, strongly against medicated birth. But the problem is sometimes medicated or other medical means are needed. So this leaves the couple rather unprepared should it arise. Lamaze, Laboyer, Bradley, gentle birthing, hypnobirthing, and the Mongan birthing. What are they? What are the differences? You might feel overwhelmed, so I put oh my. As I mentioned, Lamaze is the preferred method of preparing for childbirth. It really has no downside. Mom needs less painkillers, which is good for her and good for the baby who also receives the painkiller via the placenta. The baby has a better APGAR score, which is a rating of their vital signs at birth. And as I mentioned, a more positive experience for the mom and probably for her partner, if a partner is involved. It has some basic components: a coach, which may or may not be the partner, breathing types. The panting type is probably what we think of most. This supposed helps to oxygenate our tissues during this very laborious process, and it also helps to distract. Massage might be helpful. It's part of the process, a focal point that mom can focus on. And education, which makes the process less scary and makes her feel more in control. Many parties interested in the Lamaze procedure find "Thank you, Dr. Lamaze" to be a maybe preferable read as compared to the original, more old and obviously more dated text, the original text, Painless Childbirth. So as noted on the earlier slide, Lamaze is the most commonly used method, also called prepared birth. It was based on a conditioning technique first used in Russia. Dr. Lamaze, a French OB/GYN physician, visited Russia and was astounded that the women were giving birth without being medicated out of their mind, and it was going well for them, and it was a positive experience. This is not the way it was in the United States or Europe. They were heavily medicated at that point. So this technique of the Russians, not surprisingly perhaps, based on Pavlovian conditioning, was written about in his book and became the dominant choice of birthing not only in France, but later on in America as well. Let's consider some delivery-related details. It's very typical for a woman to have an IV to either sometimes slow down delivery, believe it or not, or alternatively, more often, to speed it along. Hence the next bullet point. This help is needed somewhere between, I'm doing rounding here, about a third to pushing half of deliveries. What help is given? Well, the hormone involved in uterine contractions, oxytocin. It's also sometimes given to help the placenta if it's not separating fully. In hospitals, 95% of deliveries will involve fetal monitoring. If this is not desirable to the woman, she might be perhaps a very good candidate for a birthing center. Episiotomies, an incision made between the vagina and the anus. Doesn't sound nice, but the idea is that a nice surgical incision is much better to heal than a ragged rip. I asked a friend of mine about it, and she told me, don't even worry about it. You're in so much pain when they do it, you don't even notice. I didn't take solace from that. Anyway, C-sections, about 1/3 of all deliveries, at least in the U.S. currently. Nitrous oxide, perhaps you've had that at a dentist for pain control, has been available in Europe for well over 100 years, and yet it's fairly recent availability in the U.S. Currently less than 10%, but is rapidly increasing in the places offering it. So your place probably won't have it, but it's worth asking. Typically, the stages of childbirth are referred to by the events that are taking place. I left a few blanks on the slide, so consider them, and then we'll move on to the next slide, which will tell you the answers and discuss them in more detail. On the next slide, for convenience, so I will call stage 1, stage 2, and stage 3, but just for convenience. So let's consider these stages. Stage 1, the stage of dilation, which means to widen, and effacement, which means to thin, of the cervix. A typical cervix, if you have one, feels like the tip of your nose. During the delivery process of stage 1, it will dilate to 10 centimeters, and you probably hear medical dramas all the time that she's at 10 centimeters, she's not at 10 centimeters. During this stage, the water will typically break on its own. If not, it might be done by the medical practitioner. This stage is highly, highly variable in length, but for a first-time mom, about 10 hours. It can be much shorter, it can be much longer, but where she's caught in the taxi, although obviously it does occur, typically not. You've got many a hour of this process. In stage 2, it's the active delivery of the fetus. She'll have the urge to push. On average, it takes an hour and a half, quicker for a second-time mom. She may or may not need an episiotomy, but chances are pretty high that she will. This is an incision made between the opening of the vagina back to the anus. With the philosophy, it's better to have it done rather than a jagged rip, so it's a nice clean surgical incision and it's sutured up. Stage 3, some women actually report this to be the most uncomfortable part, others not, but delivery of the placenta or the afterbirth, typically the medical assistant is going to be pushing firmly on the abdomen, and it can take 5 to 15 minutes. Birth complications are fairly common, even in American hospital deliveries, up to 25%. Now, if that scares you, the majority of those are just delayed delivery, extended delivery. So the contractions aren't vigorous enough, and that might be helped with a hormonal injection. In terms of severe complications, such as listed below, that's about 7% of births. So I think that's probably good news for you. Now let's consider the complications listed below. Having a multiple pregnancy is considered to be a high-risk pregnancy, and it's also a higher risk delivery. Placenta previa, like the word previous, this is when the placenta is coming out before the baby, which can cause issues with the blood flow, so is considered to be very serious. Also, even more serious would be placenta abruptia, when the placenta prematurely separates from the uterine wall, causing hemorrhaging, which can threaten the life of the mother and or child. Transverse is shown in the picture, so the side or back is presenting first, and the baby can typically be rotated manually. Breech position would be feet first, has a higher rate of complications. I was a breech. All these can lead to a cesarean birth, which we'll discuss in an upcoming slide. I should add, in terms of the breech position, probably of interest if you are a person that is pregnant, is about to be pregnant, your partner is pregnant, or you're a breech position baby yourself. Most breech position babies will naturally right themselves, quite literally, by the end of just after the 4th month. So early wrong position is not necessarily problematic at all. Breech position babies are more likely to need a C-section, and breech babies unfortunately do have a higher rate of intellectual and other developmental difficulties related to anoxia during the birthing process, which would be avoided by the C-section. Let's consider a decidedly non-natural way of having childbirth, that of the C-section, or if you want to be more formal, the cesarean section. Reputedly, this cesarean section named after Caesar, who was supposed to have been delivered in this manner. Was he not? No way of knowing at this point. We do know that in terms of how common it is now in America, it represents 1/3 of all U.S. births, so a very substantial minority. It may be scheduled or it may be an emergency. In the past, it wasn't unheard of for women to just schedule for convenience. But is this a good idea even if you can convince your doctor to do so? Decidedly not. It is not easier. It has association with more pain during, obviously, the recovery period, more complications, and an extended recovery time. So if it's necessary, it's a godsend, but hopefully it won't be necessary. On the left, we see a baby being delivered by C-section, and above it, scars that might be the result of a differential procedure in C-sections. In the past, once the abdominal muscles were cut, the incision in the uterus was made vertically rather than horizontally, which made it much weaker permanently. And there was a saying back in the day, once a C-section, always a C-section. Nowadays, a previous C-section does increase risk of need in the future, but is no way condemning that procedure to be definitely necessitated. So good news if a woman does have a cesarean. The two biggest risk factors for a newborn's survival and later health and development are prematurity status and low birth weight status. Preterm is generally considered before week 37. And do you know which particular bodily structures under development puts the baby at the highest risk? Well, if you're thinking brain or heart, no, it would be the lungs. That is the determiner of the survival. For low birth weight, the cutoff is 5.5 pounds. They have difficulty maintaining their temperatures, hence the cute little hat the baby's wearing above. It's the most easily prevented of the neonatal issues. Proper prenatal care and adhering to the regime the medical professional gives can greatly reduce risk. Not all low birth weight babies are preterm. Some are full term and are low birth weight. Both these increase various conditions such as feeding problems, infections, neurological issues, and also of SIDS. I thought we'd end this chapter with a few pictures of Ann Geddes, though I did place a few review slides for you after it. The second slide, the one right after this one, is non-Ann Geddes, but I thought it was cute, so I decided to include it. So I hope you enjoy these pictures. Although not a typical Ann Geddes picture, this is one of my very favorite of hers. I just love his facial expression. You probably, or at least may know the average newborn weight. Mentally try to guess it for a moment. But you probably don't know the weight increased by age 2. The average newborn weight, 7.5 pounds. By age 2, obviously 2 years later, they will weigh about 4 times that weight. So for example, I would weigh in 2 years, if the weight increase was the same for me, 552 pounds. Take a moment and think of your weight times 4. Isn't that amazing that they are able to grow that much in such a short time? We take it for granted, but it really is amazing. Although young babies make wonderful pictures, the newborn baby is not in any way a pretty sight.